Hello everyone. Welcome to the another success story. So today we are going to hear from Dr. Kelvin. Dr. Kelvin is a very good friend of mine, and a big congratulations to Dr. Kelvin for your big success. All right. So first of all, Dr. Kelvin, what we want to hear from you is your full name. Okay, you are going to give your names and from where you are currently working, okay, when you have passed your part MRCS part A, and what was the thought that you are going to give for part B, how much time you have taken, what are the resources you have taken to overcome all of your obstacles for the exam, right? So yeah, the floor is yours. You can share yourself.
Okay. All right. Before I begin, I just want to say thanks to Dr.
No, no,
Teak.
most welcome.
But,
Yeah,
that's the truth. That's the truth. Because
right.
okay, so my name is Kelvin Tetteh Ahulu.
Mm,
I'm Ghanaian, so I'm from Ghana.
right.
Started my MRCS journey. We are in 2025, so I think I began in 2024.
Okay.
That's
So 2024, in which month you have given your part A?
I think it was in either January or February, one of them. It was the early ones because I
Okay.
wrote
Okay.
mine
So
in
it's
the
in
States.
January, I guess.
Yeah, in January,
Right.
yes.
Mm, mm,
I wrote mine in the States and I passed. So after I passed, I was looking out for which course would be beneficial to
right.
me. And
So
uh,
you are currently working in Ghana as well, right?
yes, I'm currently working in
Right.
Ghana. Yes.
Mm-hmm, mm-hmm.
I was working full time at the 37 military hospital.
Mm-hmm.
But due to the exams, I needed time for myself and all these
Right.
things. So I kind of
Right.
quit that and I
Mm,
ended up so I'm now doing locums. So I work
mm,
at a facility called Rema Rafa Medical Center.
mm-hmm.
Yeah.
Okay.
Yeah. So so I wrote my exams in the States. I was
Mm-hmm,
actually on a trip with family and I decided
mm-hmm,
I was reading about MRCS. I wrote PLAB 1, which I passed, and I was like,
mm-hmm.
I want to work in the
That was a
UK.
mistake.
Yes, I
That
want
was
to
a
work in the
mistake.
UK. I
Yeah.
want to be a surgeon, and I don't see the need for me writing a plab
Right.
anymore. So
Mm,
I heard about the MRCS. I was like, yeah, let me just take that journey.
right.
And I think that would be much better for me because
Correct.
even if I did write my plab and get work in the UK, I would definitely need to write the MRCS. So
Right.
why would I still, continue with the
Correct.
plab journey? Yes.
Right.
So I did my part A, which I
Mm-hmm,
passed.
mm-hmm,
Uh, yeah. And then the part B, I was looking out for what course would actually beneficial to me.
mm-hmm.
There were courses that, they were okay, but if maybe you didn't make it, you would have to repay
Yeah.
to join
Definitely. Yeah.
again. I was looking
Yeah.
at them like the exams itself is expensive.
Yeah. It's
If
too
I don't make
much.
it, I
Yeah.
have to pay for the exams fee and then
Yeah.
have to pay for the course again.
Right.
I wasn't really looking at that.
Right.
So that's when I don't know how I came about you. I think I was on YouTube
Mm-hmm.
and just surfing on
Random
YouTube.
videos.
And then randomly, I saw IMG Academy. I saw people's success story. And I was
Yeah.
like, okay, I like this. I like what I'm hearing. Everyone
Right.
was doing really well. They were getting
Mm-hmm.
really high scores. So I was
Yeah.
like, okay, I feel like this course is for me. So I
Mm-hmm.
contacted you. I got a telegram from the YouTube page, joined, and I think I asked about joining, and then you contacted me about
Yeah.
it. And that's when I joined IMG.
Right.
When I did, I think I wrote my first, so this is my second try, which I
Yeah.
passed. I
Yeah.
wrote my first one in October. But the truth being, I wasn't, it wasn't like I wasn't fully invested in the studying,
Yeah.
but I just didn't know what I was about in the PAB.
Yeah.
I didn't do a lot of mocks. I was
You were
just,
just going through all the resources and
going
just
through
like, okay,
everything.
let have a try, just like that, right? And
Yes, something like
I
that.
can still remember, you didn't have that much time in your hand when you have
Yeah.
joined the course, and before the exam, I think you had like maybe 2 months or 2.5 months or something like that.
Yeah,
Yeah.
exactly,
Yeah.
exactly, exactly. Because we wasted a lot of time. I have a group of friends which we
Hmm.
wrote the party together, and then we later joined IMG. Yeah, so together. So
Yeah.
like we were wasting a lot of time trying to figure out where to
What to do, what
join, where
not to
to
do. Yeah.
what not to do and all those things. So by the time we joined, I think there was a little bit much less time. And then we
Mm.
asked you, should we write in the UK or write? And then you were like outside UK because outside UK is easier.
Yeah.
It's much more convenient for us compared
Yeah.
to. But then the thing was, I'm Ghanaian. Those I
Mm.
studied with were also in the UK already, so they
Yeah.
going outside. It was quite
True.
impossible for them.
True. True.
I also thought about India. I'm like, I need a visa to go to India, and I
Yeah.
need a visa to go to the UK. I've been to the
Yeah.
UK severally, so why don't I just go to the UK? Because it's
Right.
easier for me to get in there. So I wrote my first one. I'm registered with the Royal College of Edinburgh. I
Mm-hmm.
wrote the first one with them,
Mm.
and that was in Edinburgh, in the city of Edinburgh itself, which didn't go
Mm.
well.
Mm-hmm.
My scores were really horrible, trust me, really
Yeah.
horrible.
Yeah.
So
You told me that. You told me
yeah,
then.
yeah. I
Yeah.
texted you and I said,
Yeah.
Dr. T, these are my results.
Yeah.
What do
What
I
can I
need to
do?
do?
Yeah.
And then you said, I need to participate more in class, do a lot of mocks and all that.
Right.
And then I told you about the
See,
time.
just one thing, Dr. Kelvin. I
Yeah,
just want to add a single thing here, right? See, many of the candidates join IMG, right? And
yeah,
when they will not pass, they will just simply text or they will simply call me and they will mention, all right, hey, doctor, I couldn't pass it. I couldn't make it, right? I don't know what I have done, wrong or how can
yeah,
I overcome this? See,
yeah,
trust me, many of them, like almost 50% of them are just like you. They just join and they never come in front of the classes, the mocks. They never
yeah.
join, right? So
Hmm.
they just gone through the recordings and like all that stuff,
Exactly,
right?
exactly.
Always, always. And you know that, during the mocks, I always mention few new questions, right? So
Yes.
that you guys can
Yeah,
cope. And also about the QRC. In the QRC, few new questions will infuse as well, right?
yeah,
So that
that's true.
in every cycle, you guys will be prepared for the next, from the next previous exams, right? For
Yeah,
fresh
yeah,
questions.
yes.
So now, if you're living on recordings, then how you can cope up,
That's true.
right?
That's true. That's
So
true.
yeah,
Yeah.
so but
Yeah.
it's a choice, it's a priority, right?
Dra- That's
It's a
true. I
choice.
always
Yeah,
said everything was priority.
yeah,
Sometimes you want to start class and there are like only five people there, and then you tell
yeah,
us it's all about priorities
yeah,
and all those things. So yeah,
yeah.
I had to juggle between work
Mm.
and also being available for the normal classes and being available for the mocks.
Mocks, yeah.
So yeah. So when I told you that and you said I should participate more, and I said, okay, I was going to do that.
Mm.
So before, I think after results came, I think you were done with all the anatomy and
Yeah,
you had the latter part of the anatomy. So that's when I
yeah,
started actively
right.
participating.
Mm.
I also told myself that I feel like the exams was in person, where you're like how we have this live video cameras on.
Yeah.
So I told my friends that when we are studying now, our cameras
Mm.
shouldn't be off. The
Correct.
camera should be on and we are looking at each other and answering because I feel like sometimes you can be with the camera off. I sometimes see people, you can hear people are flipping pages when they are being asked
Yes.
questions
Lots
in
of
class
lots of
and
times
mocks.
during the mocks,
Yes,
right? During the mocks,
yes,
yeah,
during the
yeah.
mock.
Can you please ask me the same questions once again? Sorry, I couldn't get
Yes,
you, right? And they're just
yeah,
scrolling the screens, they're just
yeah,
flipping the pages, right? I can
yeah.
hear that even in the
Yeah,
mocks, yeah.
so I really told myself I was going to be, I was going to train myself not to open any, scroll everything. If I don't
Right.
know, I just don't know, and I'll try and do better.
Correct.
So that was one thing. So with my friends, my video was always on. In
Mm.
your class, I think is when it gets to the communication part that you let the cameras come on.
Yeah.
And I even wanted to tell you that I
Mainly
wish
in the skill
even
part.
throughout
Mainly in
the
the skill part, yeah.
yeah, the skills pass. Yeah.
Yeah.
So I really wanted to tell you that I really wish we had the cameras on throughout every class, whether all the mocks, like
Yeah.
from anatomy, we had the cameras on so that we can all really immerse ourselves in actually facing the examiners, like how it's going to
Yeah.
occur in the exams.
Right. See,
Yeah.
see, one thing is, Kelvin. See, suppose you have just started the course, okay, and
Yeah.
you didn't book your exam, or maybe you have booked your exam, but it is 6 months away, right? So you cannot
Yeah.
feel the pressure, right?
Hmm.
Or this is your first time. Just think like
Hmm.
that. So when you have given your exam for the first time, were you that much serious for doing all these stuffs? No.
No,
right?
I wasn't.
No, right?
I
To be
really
honest,
wasn't.
no, right?
I really
So
wasn't.
maximum amount of the candidates they will not participate. Trust me. What I need to
Yeah,
do, I need to break their eyes in the first place, right? Keeping it
yeah.
hidden, all right, all right. If you want to check the pages, you can. If you want to flip, like, or if you want to just scroll down, okay, you can do it, right? But at least participate, but at least
Mm-hmm.
come and give the mocks, at least participate into the class, at least talk to me, communicate with me, right? I need to
That's
break the
true.
ice with them in the very first place. But
Yeah,
now,
that's true.
what if I'm gonna do from the very beginning? No, no, no. You guys need to start with the, like, camera on. You cannot look at here and there. They're not gonna participate. Trust me. Even
That's true.
you will not participate in the very first
That's
place,
also true. That's also
right?
true.
So when you
Yeah,
will
that's
have the
also
exam, like ticking, it is after a month, then you will hit. Like, okay, let me take all the pressure. Yeah.
yeah.
Let me
True.
take all the
That's
pressure.
true.
Bring it on. I want to give it all, right? Because I want to pass. I failed one time. Now I don't have anything to do. I need to pass it. This is my priority. Yeah.
Yeah, yeah, that's true. That's true.
Yeah.
So my advice would be for future candidates and those
Yeah.
preparing, please actively participate. And
Yeah.
also,
Yes.
if you're
Yeah.
starting, you might think, oh, it's too early for me to, think about maybe my exam is 6 months away. But trust me, the discipline that you start with is what you end with. You
So
wouldn't want
yeah,
to write this exams.
with this thing, I want to ask to you, did you made any specific schedule for your preparation? Like, as you have mentioned, like you need to have a discipline, right? So yeah.
Yeah, I actually did. My wife made a schedule for me.
Oh, brilliant.
Yeah, she made a schedule for me, which
Mm-hmm. Mm-hmm.
that's what I used because when the first one didn't go well, she made,
Mm-hmm.
I don't know if you can see this, like
Yeah.
this is the
Oh my
schedule she
God.
made for me. So I even have it on myself. So
Mm.
we found out, we checked how many videos were there
Mm-hmm.
within the IIT course.
Even I don't know.
And
Let me know
yeah,
how many are
so
those.
I don't know, but she checked it. She purposely went through the whole file,
Okay.
checked the number of
Yeah.
videos, checked
Yeah.
how many weeks I had to my exams,
Uh-huh.
and then she told me in the first 8 weeks you have to finish everything in IMG.
Okay.
So like week one, your
Uh-huh.
anatomy is going to be head and neck one. You are
Mm-hmm.
within the first week, like week one, you are going to do seven procedures.
Mm.
Procedures and communication were seven. You are
Yeah.
going to repeat them every week.
Too much.
Examinations, 3 to 4. I'll do
Okay.
4 examinations and I'll do
Uh-huh.
two history taken.
All
That's
right.
within the first week. And
Within a
then
first week.
within the first week, that's week one.
Okay.
So like from Monday to Sunday in that first week, that was what I was supposed to do. And
Too,
she will always check up on
too
me.
much.
Have you
Too
done
much
it?
pressure, Kelvin.
I know. So
Too much pressure.
I was supposed to
Oh,
finish all that in 8 weeks. I
right.
did some to I lied to
I
her.
think I need to hire her for my IMG.
Yes,
Yeah.
you need to.
She's gonna
She
make
really
all the
put,
schedule and put the all
yeah.
the candidates in pressure. Like, guys, you need to do all of these steps, right? Tick, 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 tick. Yeah.
I know. And
Yeah.
then at the end of the week, she'll ask me questions, like the head and neck one, she'll ask me questions. And then
Wow.
we'll do the communication, we'll
Uh-huh.
do the history, in like two history taken for the whole week.
Hmm.
So you can decide, I decided to do maybe head and neck one will be for Monday. The
Hmm.
procedures, there were seven. So each day I did one procedure,
Right.
like the seven procedures, one each
Hmm.
day. Then communication, since there were seven, I did seven each day. Examination four, I did one each day. History
Hmm.
taking one each day. So that was
Hmm.
two. So I went through that within 8 weeks. So within 8 weeks, I'd gone through the whole IMG archives.
Like within 2 months, yeah.
Yeah, within 2 months.
Hmm.
Then
You have
after
covered
that,
all. You have covered it all.
yes, I've covered it all, but still the
Hmm.
classes were ongoing. And
Right.
then it started with we starting the QRC. So before the QRC, I was really prepared because
Hmm.
sometimes before QRC, it's like we are not done with the main class. So you
Correct.
have
Yeah.
to juggle between being
Live
in
class,
QRC
class
and
recordings, the
live class
QRCs,
and
all that
all other
stuff.
things.
Yeah.
So
Yeah.
there were a lot of,
A
yeah.
lot of
So with
things
that, it
ongoing.
really
Yeah.
helped me to be prepared
Right.
for the QRC.
One
But
thing
nothing really.
I just want to interrupt here. I'm really sorry about
Yeah,
that. What I have
don't worry.
planned is you guys need to be very active. right? In
Yeah.
order to give the exam and in order to be in IMG as the active candidates, you guys need to be
Yeah.
very, very active. You need to join the live class. You need to join the live mocks. You need to participate into the course. If you are like,
That's true.
exam is near, you need to go for the class recordings. You need to go for the exercises, practices in the QRCs as well. Lots of things are ongoing, right? So I want
Yeah.
you guys to be very active,
Yeah.
right?
So that was
Mm,
true. So after the 8 weeks,
mm,
I then realized that anatomy, I was listening to your first video on
mm,
spine anatomy, and then you
mhm.
stated anatomy is volatile.
Right.
So we should keep repeating it. And
Mm,
that's when I made a plan and I told my colleagues, those I study
mm,
with, my friends, I told them,
mm,
this is what I'm going to do. Every morning I go for a walk.
mm,
I do about 10 kilometers every morning because I'm trying to lose weight. So
mhm,
that 10 kilometers, every morning I
mm.
listen to one anatomy videos. And the anatomy videos are seven. So at that
Yeah.
point, I was done with my 8 weeks. There were seven anatomy videos.
Mm,
Every morning I listen to one. So I start with spine and thorax on like Monday,
mm,
then spine and spine. Then I go to upper limb on Tuesday,
mm,
lower limb on Wednesday. Then I go to the trunk on Thursday,
mm,
thorax on Friday, head and neck one on Saturday, head and neck two on Sunday.
mm.
Dr. T, trust me, I did that every day till my exams, every week
And
till my
like,
exams.
and trust me, even like if you are just listening to that, you will not feel bored, right?
Yes,
Hearing of the
yes,
anatomy because it is so
yes,
connected and you can feel
yeah,
it because it is gonna work for your day-to-day activities, day-to-day life as well,
exactly,
right? As a
exactly,
surgeon, right?
exactly.
So you will not
Yeah,
feel bored for that, right? And if
yeah.
you can watch, that will be a cherry on top, right? So if you can watch all
Yeah,
the 3Ds and
yeah.
all that stuff,
It
yeah.
got to a point I could literally know what next you were going to say in the in the videos because I was
Yeah,
I was doing that every day. Like I'm going on my walk, I'm
right.
listening. And so it's like I every time. So I even involved my colleagues. I told them, okay, I go for walks this time. So I'll call you guys and then you join on the Zoom at so
Mm-hmm.
we start around 4:30 a.m. in the morning.
Mm-hmm.
That's GMT zero UK time.
Mm-hmm.
And then they all listen to me, but they'll be in bed. So they listen, and then we all listen on Zoom till till
Right,
like the videos are done. And like we all
right.
did that. So
Yeah.
anatomy, and even with that, if you missed 1 day or 2 days of it, you come back
Mm,
and it's like you never really heard it. You miss like you there were some tiny details you could not really answer. So
mm.
anatomy is very volatile. I'll tell anyone who wants to take these exams, constantly practice. Do not say, "Oh, okay, when did we do
I can do
anatomy?
it, right? Yeah.
Yeah, I can
Trust
do
me,
it."
after
Yeah,
7 days, you will forget everything.
not even said 7 days, a day. After a day,
Yeah,
when you're asked a question, you'll be like, did I really learn this? Because
yeah,
it's really there are a lot of details and you
yeah,
might end up forgetting one or two.
yeah,
Then I focus more on anatomy and critical care.
yeah.
Pathology, I said pathology
All
was
right, be it.
really all over the place. And I
Yeah.
didn't know what
What I'm gonna
exactly
say.
was going to happen. Yes.
Right, yeah.
Another thing I did was a trick. It's not like a trick, but what I
Mm,
did was when I was going to write in the UK the first time, I was the person that wrote on the first day.
yeah,
We were the first day, and in the
mm,
first day, you were like the guinea pig for the rest
true.
because you don't know the questions because
Right.
every it's like every exams there are it's the same set of questions,
Hmm.
but like they're from different blocks. So
Right.
probably let's say critical care within um if there is an exams in May, maybe they are
Mm,
going to be asking about, let's say, gastric outlet obstruction
mm,
and probably extradural hematoma and probably, let's say, spine fracture. Those were the questions we're going to ask.
mm.
When there is an exam in October, it wouldn't be those three things. It will be some different block from critical care.
Yeah,
So if you register and like you are one of the first people, you're really going to be a guinea pig for the
yeah,
rest.
true.
Yeah. So what I did was I booked when I booked early and I booked for Buckingham, which was the last day of the exams. So
Hmm.
by the time it was due to my turn, I had an idea of how like
The
what they were
patterns.
actually going
Yeah,
the
the
patterns.
patterns. Yeah.
And yes. and
mm,
I figured out the patterns. So it's like you streamline your focus, and that
yeah,
really helped. So I'll
mm-hmm,
tell you if you're booking, especially if you're going to write in the UK and you are not
mm,
UK trained, I would
mm,
say try and look for dates later dates. Don't
yeah,
look for early dates. Yes,
mm-hmm,
that's what I'll say. And try to create a whole network where at least you can be able to get some recalls so that you can
right.
be able to get your patterns.
The stations, yeah.
Yeah, the stations. So the
Mm-hmm.
critical care, I focus really on that and anatomy. Pathology, I just went through the motion with pathology.
Yeah,
Trust me, I
yeah,
didn't
yeah,
really.
yeah, yeah. As I
The
had said, like,
communication,
during the courses as well, I have mentioned like you guys need to focus on anatomy and the critical care more because the
yes,
bulk of the stations are coming from that, right? So
yes,
maximum
exactly.
of
You
amount
stated it.
you are having from that. So if you
Yeah,
can like crack that, definitely you're gonna crack the knowledge. And just like
yeah,
that, in case of the like skill, you need to crack the clinical examination. That's for sure, and the history
mhm,
taking, and
yeah,
the rest of the tools will come just as well.
yeah. So, and this exams is financially consuming. That's the truth.
Mm, yeah,
So it got to
it's
a
very
point,
very
I
costly.
even texted that I told you I wanted to come to Bangladesh to do a hands-on course because I'm
Yeah,
like,
yeah, 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 yeah.
we do a lot
You
of
told me,
things
yeah,
at work.
yeah.
We do a lot of things at work, but probably it might be wrong.
Mm,
And when you watch the videos, yes, you watch the videos, you see everything, but it might probably not be, you might have some petty things that you are not doing right
yeah,
that might really not, conform with. So I really wanted to do a hands-on course. So I
yeah,
asked you, and you said Bangladesh is really far from me, so it's
yeah,
quite impossible for me. And I was like,
yeah,
okay. So that's when I made the decision. I was looking for because I'll be going to the UK, so I was looking
yeah,
for hands-on course,
yeah.
and my colleague sent me one, and I was like, I
Mm,
didn't really care who it belonged to or anything. I even informed you that I
right.
really wanted to do a hands-on course because I wanted to get my hands on
Right.
let's say the
A little bit of
system.
like, you will have a confidence boost for that.
Exactly,
Mm,
exactly.
mm,
So I did the hands-on course when I went to the UK. It really
mm,
helped. It really
mm.
helped. Plus your videos, assimilation of that with your
Yeah,
videos.
yeah,
Your clinical examination videos are just top-notch. That one, it's very good. It's very, very good. But if one is writing the UK, I would
mm,
say be very, very, very communicative and be very,
yeah,
very professional. In the
yeah,
UK, that was very, very essential.
yeah,
Like if
definitely.
if if you're even going to the back of the patient to examine them,
Mm,
you have to inform them, and please, I'm going to your back to examine you. Are you comfortable? You
yeah,
have to be
yeah,
really polite.
yeah,
Everything you ask, even you ask the patient to stretch your hand before you touch the hand. Are
yeah,
you comfortable with me touching your hands? Is
yeah.
there any discomfort? You just have to be very, very polite.
Very,
Everything be
very
very
polite, very, very communicative with the patient. You have to be.
exactly.
Otherwise, it's like, they are looking for those things only in the
Yes,
UK.
they are not really looking at if you really know
About
how to
the,
do
yeah,
your
yeah,
exam. No,
yeah,
no, they are
yeah.
looking
It's
for
not like that.
throughout the whole exams. What I noticed was everything was about communication, even from your
Yeah,
knowledge part
yeah,
to everything was about communication. They were
yeah,
looking for your communication. They were looking
yeah.
for that. Yeah.
Like,
So
trust me, trust me. So I know whenever any candidates, okay, now at this point of time, after like, I can say after 2.5 or 3 years of running this academy and all that stuff. So
yeah.
whenever a candidate comes to me, to be very honest, Dr. Kelvin, I have never mentioned this to anyone else before. Okay. So
Okay.
whenever one candidate comes to me for like, joining the course and something, I can get a instant feeling like, like this person can do very nice. This person cannot do all right. And this person can have a 50-50 chance. So if he
Yeah.
can polish or if she can polish herself a little bit, then she can do well. Why? Just because how you talk, right? What is
Mhm.
your tone, right? What is your
Yeah.
like like gestures, body
Mhm.
gestures, right?
Yeah.
The depth of your knowledge. You can sense
Mhm.
all of those things. Yeah.
All right. Yeah.
So I think that really matters in the exam, right?
Mhm.
The moment you walked in, they have started to judge you, right? Are you
Exactly.
confident?
Exactly.
Right? Are you
Hmm.
confident? Are you smiling while you are mentioning the things or whatever you are doing, right? Are you smooth enough, right?
Mhm.
Do you have any jerky feeling, like, whether I'm gonna do it or not, right? If you have any jerky movement or not, right? So they are gonna check all of those things in you. Yeah. So,
Yeah.
and you need to communicate. You need to communicate. Like, lots of times we have, mostly in our subcontinent, we have the problem with the language, right? We have the
Yeah.
language barrier, correct? So
Yeah,
we
that's true.
cannot sometimes, like, share our feelings, share our thoughts, share our knowledge,
Hmm.
whatever we are thinking, right? We need to translate those things into English, and then we need to
Yeah,
deliver those things, right? So
that's
that's
true.
a big, big, big problem for us. Yeah.
Hmm.
So they're gonna judge for those things as well. So
Hmm.
the moment I talk with you, the moment I can see how you're talking, how you're doing all that stuff, I can have a sense of that. All right.
Yeah.
So you now
Okay.
you know what you're mentioning,
Yeah.
right? What I have mentioned, now you know exactly what you were mentioning,
Yes,
right?
exactly. 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 So we continued with the mocks, we
Mm.
continued with and then we got to the skill session.
Yeah.
The skill session, as I stated, your examination videos were really good. And then communication, it was like you go to the exams and everything was like as you really stated.
Yeah.
Yeah, maybe some pictures, one or two within anatomy would not really be from exactly because I'm not sure anyone would or any course would have exactly what they are going to ask in anatomy because the
Yeah.
images
See,
they
this
could
is
be
not
from
possible,
everywhere.
right? This is not
Yes,
possible. Definitely, this is not
yes,
possible because in every exam they can change the pictures.
yes.
So it's
They
definitely it's
have a
not possible.
large scope
Yeah.
of cadavers and images they
Yeah.
can easily get. So
Exactly.
that is not is really not possible to
And
say.
that's why I have never ever promised that in case of the IMG we are going to have the exact same images as just like the exam. It's not
No, no,
possible,
no, no.
right?
No.
That's not possible.
Yes.
That's
Yes.
why the idea came. That's why I needed to start with the 3D things, right? So that
Yeah,
you guys
your
can have the idea.
the 3D is really amazing. It's
Yeah,
really amazing. And
right.
I would tell everyone if maybe if nothing and you want to be your anatomy to be on point, just join IMG for that 3D.
Just
Because
for anatomy?
I think other courses don't do the 3D. They just
No,
do
no.
just some sample images.
Oh,
But the
trust
3D,
me, I don't know whether you have joined any other courses or your friends have
no, no,
joined
no,
other courses. I
I
don't know
didn't
about
do,
that. But see, in the other courses, what they're going to do, they will sample, like, show the samples, the images,
yeah,
and they
yeah,
will stick with the, like, identifying points, right? And
yeah,
even
yeah,
like
yeah.
in
That's
case
all.
of the critical care, the muscles and all that stuff. So, and also the questions, right? So they
Hmm.
will simply, like, read the question and they will just simply answer or read the answers just like that. It's just
Yeah,
like
yeah.
reading, right? Come on, we all can read the question and answers. So why would we
That's true.
need the
That's
course
true.
for that, right?
That's true. That's true.
Yeah,
The 3D imaging really helps. It helps to understand. Then from
yeah,
there, you can then apply it to the pictures.
yeah,
That's what
yeah,
I saw. Like
yeah,
when you understand the 3D image,
yeah,
you can then apply it to the pictures. That
yeah.
and it was really
So
good.
Dr. Kelvin, when I have started my first course, in the first course,
Yeah.
it was not just like this, right?
Okay.
It was not like just like this. So it was just like
Oh,
simple, like, I will show the images and I will try to make
yeah.
you understand by the
Yeah.
images, right? Very hard,
Yeah.
very tough, right?
Yeah.
I will
It'll
try
be
to
very
make you
difficult to
understand,
understand.
very difficult. And you guys will mention, yeah, I can understand, but in the back in your head, it is not just like that, right?
Yeah.
So
There'll be some doubts.
yeah, definitely. So I tried to do that in my first course, right? So after that, one of the candidates said, uh, like, what is the difference? Yeah, what is the difference? What you are doing? Because it's the same. I think it's not that much good. Yeah.
Mm. Yeah.
So then something struck to me, right? Okay, exactly what I'm doing, right? Why I'm doing this? Because, this is putting nothing as a knowledge for you, right? You can
Yeah.
do this by yourself, right? If you can see the image and if you're going to check, okay, this is the bicep, this is the tricep, this is that, right? You can identify those things by yourself as well because all of those things are written there, right?
Yeah.
So I need to
That's
figure
true.
it out how to make sure that you guys truly understand, right?
Mm-hmm.
And that's
Yeah.
when I have started to applying for those treaties. It is very hard and complicated.
Mm-hmm.
Like, if I wish I could show all of you how I take the class, right? I need to attach my iPad with the MacBook with the, like, another iPad, so that
Oh, okay.
I can run the, like, you can see I can write, right? And also I
Yeah,
can
yeah.
move the 3D models also
I,
with the
I always
pointers I can
wonder how
show,
how you're doing
right?
all that.
So it's a complicated things, right? It's a so
Yeah.
complicated things that, and also all the, like, sections. Suppose I'm gonna
Mm-hmm.
mention about the shoulder, it is different. It is scattered in a different ways, right? I'm going to mention about the
Yeah.
liver, so it is been scattered in a different way, right?
Yeah.
So
Yeah, that's true.
if I'm going to start with the single bones, and then I'm going to add all of those organs and the muscles, and I'm going to remove that, it will take a long time, right? So
Yeah.
for a single slide, I need to put a little bit of effort and time, so that I can make a, like, correct sample for the our exam oriented things, right? It
Yeah.
doesn't make
Yeah.
any sense if I'm going to mention each and everything for the liver, each and everything for the stomach. It will not make any
Yeah.
sense. I have to be exam specific as well, right?
Yeah. Yeah.
So yeah, like, Alhamdulillah, you guys like that, and that's a
Yeah,
big
it's really
thank you for
good.
that.
It's really
Yeah,
good. Yeah. So another thing was with the skills, as I stated, I went for a hands-on course, but another thing I also did was I did a basic surgical skills, which was organized by
yeah,
the Royal College of Edinburgh. I
yeah. It's very good.
registered for that,
Yeah.
and it was really good
Mm.
because they
It
taught
helped
us it's
you
not
in case of
everything
the
that.
procedural skills. Yeah.
Yes, the procedure
Yeah.
skills. They
Mm.
teach you like the knot process, and you are doing it
Mm-hmm.
with like a consultant of the Royal College, and they
Yeah.
tell you exactly as they wanted it for the exams. Because I told them
Right.
that when there were other people, some were F1, FY1s, FY2s.
Mm-hmm.
They were doing it just because they wanted it on their CV. But
Right.
I told them I'm doing it because I have my exams was due in like a week.
Yeah.
So whenever he was teaching, he would come to my table and be like, "Yeah, you are supposed to do it like this because
Mm.
they are looking for this, they are looking for that."
Mm.
And it was the same thing. So the truth is, I wasn't really surprised about my score for the skills.
Mm.
My score for the skills, I was like, I know for the skills, I was really going to do well.
Mm.
Because looking at my clinical examination, looking at the procedures, looking
Mm-hmm.
at the communication, it's like everything I've done. You know, when you do everything possible to
Mm.
pass, I've done
Yeah.
those things.
Yeah.
But
Yeah.
with my knowledge, as I stated, the images will not be like exactly like any other course because people did a lot of courses, which
Correct. People
they
go
wrote with us.
crazy.
They
People
failed.
go
They
crazy
failed.
about this. Yeah.
They failed. Everyone was complaining about the images because they're like they've
Mm.
never seen it. There were some that were even like they were like especially when it came to the ankle, they were
Mm.
orthopedic consultants in
Mm.
their own country when it came to write, and
Yeah.
they were complaining that they couldn't really understand the image. So I'm like,
Mm.
if an orthopedic consultant can't even understand the image of an
Right.
ankle joint, how do you
True.
expect me do you understand? So
True.
the images were really like like they were broad, and trust me, no academy
Mm.
really has the image. So if you think maybe you jump from this ship to this ship and it's going to
Right.
help you,
Mm.
really, I don't think so. You just need to understand the concept of things, and
Mm.
when you understand, take your time before answering every any question. That's one thing I did. Think.
Yeah.
Don't just open your mouth to talk just because
Yeah.
you feel like there's time. Don't worry. If you are able to answer everything, like all the things you're able to answer it rightly, it's better than answering wrongly.
True.
Because in some of my stations, when you answer, they don't take any other answer again. It's
Right.
like they ask you, what is this? Anatomy, especially, and you
Mm.
say something. If you say, oh, sorry, is this, the person
No, no,
doesn't
no,
take
no,
that
no.
answer. They just
Yeah.
take the third answer
Yeah.
because it feels like now you are guessing.
Yeah. Because, like, it
So
will be a 50-50 chance.
exactly.
Mm.
So you were supposed take your time, taking a deep breath, think whatever image you see
Mm.
before you answer it. Yes.
Yeah. If
But
you don't know the answer, you can skip, but don't say
yes,
the answer and come back to the
don't say
second
no,
questions.
no,
No, no,
no,
no.
no,
Simply just
no.
skip
Just
the question, move on. You can still come
exactly.
back to the same questions once again.
Yeah, and don't waste time on one question. Just tell them,
Yeah,
I would like to come back to this and then move
yeah,
on.
yeah,
That was
yeah,
it.
right.
So I remember the night before the exams, I think 2 nights or
Mm.
3 nights before the exams, we were in Edinburgh, and I think you were
Yeah,
talking to Dr. Rafudin,
yeah,
and you told me, Kelvin, no need for you to panic, no need for you to study.
yeah,
Just teach Dr. Rafudin everything you know,
yeah,
and you'll be okay.
yeah.
So that's what I did. I was just teaching him, and then a lot of people came around.
Mm.
I even had to call I had to call Dr. Sivaraban to come
Yeah,
because
yeah.
he is a rehabilitation medicine and he was really good with the physical examination, especially the
Mm.
orthopedic ones,
Mm-hmm.
like knee, ankle, hip,
Mm.
and
Mm.
spine. So
Mm.
he also came, he was in Oxford. He took an hour
Mm.
bus, came. We were all
Mm.
in a hotel. My hotel room was packed. We were about 8 doctors, all
Oh,
sitting on the
wow.
floor.
Very
Yeah,
nice.
that's true. All
Mm.
sitting on the floor
Mm.
I was telling them all the things I know from IMG and what I learned on my hands-on, and then the basic surgical skill course,
Mm.
especially the basic surgical skill course, like the things they said on the procedures, like the suturing, what exact things they were looking for, the
Mm.
knot time, what exact things they were looking for, and all those things. So I
Mm.
think that really helped because one thing I realized is when you teach people,
Yeah.
you're able to reflect a lot of information,
Lots of things. Lots of
a
things.
lot of information.
Yeah.
Because I trust by now you, even in your sleep, any anatomy question you can answer because you've been teaching that for so many years.
Yeah.
Anatomy, critical care. I'm sure if you take these exams again, you get
Yeah.
160 over 160, 180 over 180 because you've been doing this over and over again.
Yeah.
And it's not like just you learning, you are learning. Whenever you teach people, you also learn. So
Dr.
you end
Kelvin,
up.
do you know, like when I have started my own course, I didn't pass the exam. Do you
Oh
know that?
wow. No, I have
Right?
no idea.
No.
I have no
So what I
idea.
did is, as I didn't pass the exam, so I started the course to teach the other people so that I can remember, like, I can recall
Oh,
all the
okay.
questions, right? So I
Okay.
ran the, course for 1 year and then I sit for the
Okay.
exam, right? And I
Oh
didn't
wow.
have to study anymore because I
Oh
was
wow. This
teaching
is nice.
others, right?
Exactly. Exactly.
Yeah. And I got the high
Exactly.
score. That's why. As
Oh
simple as that.
yeah, that's nice. That's
Yeah.
nice. That's nice. So yeah, one thing I would say, and that also happened with me because I was
Mm,
teaching my colleagues, those I was studying with, they rose before me. I was
mm,
basically like their teacher. So we'll go there. And
mm.
when you tell us we can even jump questions, like say you come back to that,
Yeah.
we got to a point like I think 2 weeks before the exams, their exams, they'll be like, "Oh,
Mm,
Kelvin, I'd like to skip this." I'm like, "No, no skipping. You're
mm.
supposed to know this."
Yeah.
I'm like, "No skipping. You're supposed to know this."
Mm,
And
mm,
we'll just go through the motion. Sometimes there are certain questions back, and then we study, and it was really nice.
mm.
This exams was we
Right.
went through all the emotions when it came to these exams. I personally
Correct.
did, and I can't say enough. I hope my story is able to help others. But trust me,
Yeah,
if you
definitely.
fail, it doesn't mean
Mm.
it's the end. You just
True,
have to
true,
re-strategize
true,
and
true.
come back and you'll
Mm.
make it. Take your time, re-strategize.
Right.
And actively, what I say is actively participate.
Mm.
Do more than your best. You can do your best, but if you can
Mm.
do more than your best, do that. If you don't understand anything, ask questions.
Right.
Get colleagues who are also willing to study and be in a group with them. Like we were
Right.
from different areas.
Yeah.
One was from India, one was from Somali, one was from
Mm.
Sudan. I'm from
Mm.
Ghana. One
Mm.
was in the UK. Like we were
Yeah.
like
I think it's
different.
a beautiful, beautiful, essence of cultures. Yeah.
Yes,
So
yes,
yeah, it's good.
yes.
It's good. So one
It's
question to
really
you,
nice.
Dr. Kelvin. One question
Yeah.
to you. You have given the exams twice, right? So
Yes, please.
for the exam, what do you think? What are the common pitfalls? And how can you avoid those things if you're going to give some advices to the future candidates, right? Definitely, you have
Okay.
done some common mistakes. You have, gone for those things again and again. You have purified those things for yourself and you have overcome those things, right? So what are the common
Yeah.
pitfalls are there and how you can suggest to all the future candidates, all right, brother and sisters, please avoid those things, right? Avoid these
Mm.
things and do these kinds of stuff so that you can have a better result. What are those things?
Okay. All right. Thanks for the question. For that, as I stated, I think I started saying some of them.
Mm,
From the Let's take it from anatomy.
yeah,
Anatomy, I would say, don't just read it once or twice and say you're good.
yeah.
No,
Number one, yeah.
you have to constantly go through anatomy. Number one,
Mm,
that's
mm,
the best thing.
mm.
When your
Repeat
knowledge section,
repeat the anatomy as much as possible.
as much as you can, as
Okay.
much
Mm,
as you can.
mm,
Two, with knowledge, focus more on anatomy and critical care because those are six
yeah,
stations.
right.
Don't, yeah, pathology, you can go through it, but don't put so much energy into
Yeah.
pathology.
Right.
It's
And
just two
also,
stations.
also for learning pathology is not that much fascinating, right? Because you
Yes,
cannot
it's not nice.
implement those things into your day-to-day work.
Into your day life.
Yeah.
Yes, that's
So
it.
you
That's
can
it.
implement as being a surgeon for anatomy, definitely, and the critical care,
Yeah,
definitely.
yeah.
You will see some
Mhm.
critical care, critical patients, and you can just dive into those because you know your stuffs. Now you will
Yes, exactly.
love to care for those septic patients. You will love to
Mhm.
care for those intercutaneous fistula patients, right?
Yeah, yeah,
Naturally. It
yeah.
will come naturally right
Yeah.
now.
So
Yeah.
yeah. So what? Yeah. As you stated, that's true. Those
Mm.
things are easy to apply in the
Yeah.
workplace,
Yeah.
and whatever you are learning in wherever academy you are in IMG, wherever,
Mm.
try to implement it in your workplace.
Yeah.
Try not to make it like it's just exams and you're at work and you're doing your own things. No,
Mm.
change your habits, change everything you're doing,
Mm.
and use those same things at your workplace. So that brings us to our skills section. So skills, we have communication. Whatever we learned from IMG, apply those things, your history taking, your
Mm.
communication, apply it in your workplace.
Yeah.
Talk to your patients politely. Don't, where we come from, most of our consultants are not polite to the patients. We talk to them anyhow. We even shout at patients and all that. It's not the same in UK. We sometimes we are prejudiced. We judge the patients. You can't do that in the UK. So those
Brother,
things you need
we
to,
cannot do those things in any part of the world,
yes,
right?
but we do it in our part
But we
of the
do it.
world. Yes.
Yeah.
So
Okay.
as you are learning for the exams, and
Right.
especially if you want to move to the UK, make sure you
Yeah.
start implementing that in your workplace. And
Yeah.
trust me, when I started implementing that in my workplace, all my clients, when I see them, they're like, "Oh, I want to see this
Completely
doctor again."
change. They will change.
Yes,
They will change their
they,
mindset. Definitely.
yes, everyone comes and they're like, I want to see this doctor. I want to
Yeah.
see this doctor.
Yeah.
And it
Yeah.
was just me applying everything I'm learning from IMG, how to talk to the patients, how to
Yeah.
take the history, how to be polite, all those things. And that's what I was applying. So it was like, even though you are doing your work, you are still learning on the work.
Right.
And
Right.
that was some of the things that really helped me.
Yeah.
Another thing has to do with, so another thing is I realized that yes, Dr. Tick, you give us what we are supposed to do, what we are supposed to learn, the exact things when it comes to communication, when it comes to, yes, communication especially. I feel like that is more like a template.
Yeah.
Some people try to memorize that
Yeah. That's a
exactly
problem. That's a
word
problem.
for word, and
So remember
that will
what I
not
have
pass the
mentioned.
exam for you.
Yeah. What I have mentioned. You cannot memorize anything to pass this exam, right? You need to
No,
know the
you can't.
concept to crack it,
Exactly.
right?
Yes.
Whatever I'm mentioning,
Yeah.
it's a format. You can take it
Mhm.
and you need to make it by yourself, right? During the communication
Exactly.
as well.
Yeah.
Okay, this is the
Yeah.
template. You need to be like this. You need to be polite. You need to be
Mhm.
gentle. You need to have a eye contact with the candidates. You cannot have all of those gestures, right? So what I have
Yeah.
mentioned, that's fine. But like, uh, you need to make those things by yourself, right? That's a very important thing to
Exactly.
understand. So
Exactly.
you have understood that, but
Exactly.
maximum of the candidates, they will not understand about those things. That's a that's a shame. Yeah, continue please. I'll
Yeah,
just fix the camera. Yeah.
it really is a shame. So yes, as I stated, it's a template, and
Yeah.
on that template, you build on that template to have your own thing.
Mm-hmm.
Because sometimes you go to the exams and
Mm-hmm.
it's not like it's a different question, but they might ask it in a different way. And
Yeah.
if you do not build that your own method of answering things or making things right, you
Mm.
might end up saying certain things that do not correlate with whatever you are being asked.
Correct.
So those were some of the pitfalls I saw, or I did, or my friends did, or I see a lot of people doing.
Yeah.
And trust me, another thing is, which is major,
Mm-hmm.
don't try to cheat, yourself. Don't try to, trying to impress people during the mocks and all those things because maybe you are flipping pages and you are doing, no, you are just cheating yourself. you
Yeah.
you might you are answering, everyone is just you think you're smart, but at the
Yeah.
end of
But
it
if you
all,
end up the day,
no, yeah, at the end of the
doesn't make
day,
any
when you are
sense.
asked questions in real
Mm.
life, you realize that you don't really know enough.
Yes.
So whenever you are doing the mock,
Hmm.
try enough to avoid your, how do you call it, your laptop, your books, your notes that you have made. Try to avoid it so that you
Yeah.
can immerse yourself in answering like it's your exams.
Right.
Another pitfall, which we stated earlier, is if your exams is even a year away, don't put it in your mind, my exams a year away. So for now, I wouldn't focus.
Mm.
It's like if you start a year from now to your exams and you are actively participating in each session Dr. Tick begins. Maybe it's done the January session. Now he's doing the May session, and you're actively participating. Trust me, before your exams, when your exams is due, you wouldn't need to panic. You wouldn't need because everything is just like at your fingertips. Everything is final for you because you were
Yeah.
already actively participating. You were already into it. And trust me, you will do amazing. I'll tell everyone, as I stated earlier, when you fail, it's not the end.
Yeah.
You can still make it and do really, really well.
Yeah.
You do better than even people that, were smarter than you or anything because at least you've seen it, you feel it before. You
Mm.
know how the exam goes. So you'll be well
Yeah.
prepared for it as compared to people who have never written before.
Mm.
And I would say this, which Dr. Tick might not agree, it's possible to pass in the UK, even if you are not working in the UK, because we
No,
have
like,
done it.
see. It's not. I did not mention that you're not going to pass it.
No,
See,
I know you
you
didn't.
need to be into the same equivalent skills you need to have in order to
Yeah,
pass the exam, right? So what
true,
happened?
true.
Most of the candidates from our subcontinent, right?
Yeah,
They don't have that. Just for instance, I don't want to mention the name, but you know the name. Did he
yeah.
pass the exam?
No, no.
Right? Teach him, right? You taught him.
Yeah, yeah,
Yeah.
yeah,
Did
yeah.
he?
That's true.
No. He
No,
passed the
yeah,
knowledge. But
yeah.
if it was the exact in I say in Colombo or in KL, he could have
You would have
maybe
passed.
passed the exam. Yeah.
Yes,
That's the
yes.
thing I
That's
want to
true.
mention,
That's the
right?
truth. That's the truth.
So,
Yeah,
like, there are few people, they are gonna do excellent just like you, but there are few people or maximum amount of people who are gonna they could not make it just because of a very tiny few scores,
yeah. That's true.
just because
That's
of
true.
that, right?
That's
Because
true.
we simply
That's
cannot communicate in that level. We cannot, like, have the skill just for, like, practicing, just by practicing for 1 month. It's not possible. This will not come as a spine, as a muscle
hmm
memory. Trust me. You need to work for that for maybe 6 months or a year, right?
Yeah.
So that's why I said that, like, you need to have that equivalent amount of skills in order to
That's
pass the
true.
exam.
That's
Yeah.
true. That's true. That's true. That's true.
See,
So
he did the, like, the things with me, the workshop with me, right? I knew it.
yeah,
Like, come on, brother, you're going to give your exam in UK and you don't know how to tie the knot yet. How
yeah.
come? Yeah. And you're panicking.
hmm
You are like, having some tremor and all that stuff, and you're thinking to give your exam in UK. So
Yeah. You
yeah,
you have to be yourself to, the examiners. Trust me, they know when you are panicking.
Yeah.
They know when you are not being
Even
yourself.
if I can understand, then they, of course, they will.
Yes. They
Yeah.
know it. So
They know it. Yeah.
when they realize
Yeah.
that, trust me, no, it's very difficult to impress them when they realize,
Yeah.
because as a surgeon, you need to be confident. You need to know what you're about. And
Correct.
it's part of the criteria of being a surgeon. So
Mm,
if you don't have that self-belief already,
mm,
and
mm.
they ask you to do something and you're already shivering or you're
Yeah.
shaking, they or trembling, they just know that to them, they feel like you're really not going to be a good surgeon to them.
Correct.
And
Right.
even though the exams is marked based on your knowledge, based on what you are saying, they also look at your personality to also judge. And also, we are humans. I'll
True.
look at you to give you my marks.
True.
If you deserve
True.
a full mark, I might give you half of it because I feel like you were not really confident in whatever you were doing.
See, in the very last place, Dr. Kelvin, you are handling with the person's life,
Yes.
right? So it's
Yeah,
not like
exactly.
it's not just like an exam. It's a, like, it's a changing things. You are becoming one of the thing that gonna handle the person's life. So
Hmm.
if
That's
you do
true.
not change yourself, right, and if you have just only memorized those things for the exam, you're not gonna pass the exam,
That's true. That's true.
right?
And that's
You
true.
need
And
to
that's what
change
happens.
yourself. Yeah, you need
Exactly.
to change yourself in order to become a good doctor, good physician, right? So
Yes,
the
that's true.
examiner, they will crack it very easily whether this person has marked up all of those things and just pretending to be,
Hmm.
or you have already become a good doctor and you can handle those things very, very carefully, whether you are safe
Exactly.
for the patient or not, right? Those things matters. Those are tiny things, but really those things matters.
Yeah, it
Yeah,
really does. It really does. Because they are looking at the tiniest of things you might consider as
yeah,
not really
yeah,
important, but to
mm,
them, they do. They do.
yeah,
So
yeah.
I think that's all I have to say if there is
Yeah,
no other
right.
question.
Kelvin, I'm really,
Um,
really grateful that you have taken a time from your busy work. I know you are too busy, but still you have made a
mhm.
time for us. I'm really, really grateful, and I hope whenever any of the candidates or the future candidates is gonna see this session, they will have a lots of insights, right? Because you
Yeah.
have given a lots of insights about the exam and, like, about the preparation and how the exam works, how the station works, what are the things you need to do, very nitty gritty things, right? And also I have
Yeah.
mentioned few things. So I think it's a
Yeah,
very, very
that's true.
informative session, right? Instead of like, okay,
Yeah,
yeah, I have
it's
taken the
really is.
IMG course and I have passed this. I have all of those things I have done with the IMG, and that's all you need to do. Just join the IMG
Mm,
and all that bullshit.
mm,
No, right? So we have
no,
been into the really, really good things,
yeah.
the good
It's
stuffs,
it's
right?
it's
What
not it's not
exactly you
just
need to
about
do.
joining IMG.
Yeah,
It's
like,
not just
see,
joining IMG.
exactly,
No.
because I really don't care about the, like, whether you are going to join from these stations or not. That's completely
Yeah.
up to you. But what I
Yeah.
really care is I really, really love to hear from you after you have, like, been successful for this exam. Why? Because just like, once I have passed the exam, I have that feeling of the result, right? I passed the exam. But when
Yeah.
I'm again going through your success, through your life,
Mhm.
I can regain those very nice, like, lively things once again, right? And that's
I
why I
know. I
always
know.
become very fascinated for hearing these kinds of success story from the successful candidates, right? Because
I know. I know. I know.
different people, they have different minds, they take the approach in a different way. Trust me, if you are going
Yeah.
to hear all the success stories from the first one till today, right, you will be
Yeah.
amazed how the people have taken their path in a different way. Okay,
Yeah. That's true.
so you
That's
have
true.
taken your path just like an army. Okay, and there was a
Yeah.
supervisor who was looking over you. Okay, and if you cannot
Yes,
complete this, you
exactly.
need to go for a push-ups for 100 times, just like that. That's right.
Yeah.
So
Yes. That's give me 1 minute.
so yeah, sure.
I just want to put my laptop on charge.
No problem.
Yeah.
Yeah. So and some people, they just took it for 45 days. They were into the
Yeah.
class recordings and the mock recordings day and night, day and night. They did not do anything else and they did pass. So it's
Day
a
in the past.
different
Yeah. That's
approach. It's a different
Yeah, a
approach how
different
you're
approach
going to
for you.
take it, and which will, like, really, really help you.
Yes,
That
exactly.
you
Exactly.
need to sort it out by yourself, right?
Exactly.
Some people will be
Yeah.
very, very lazy. They will just simply lie down in the beds and they will just see the recordings. That's all they're doing, right? And they will pass
Yeah.
the exam.
And they'll
And
pass.
some people, they
Exactly.
will put their whole into it. They will watch, they will join the live session, more live mocks, they will do QRC, they will, like, practice with the friends, they do the workshop and all, like, they will do a lots of things and they will pass. That's a
Yeah.
different scenarios, right? And that's why this is so fascinating, right?
Yeah.
There are lots
It
of
shows how
things.
unique every human being is.
Yeah,
And
that's
yeah.
why. Like, it's not about only, like, it's not about only the IMG success stories. I really love to hear how they take their approach for the exam,
Mhm.
right? What
Yeah.
are the difficulties they have faced? What are the things you have done, like, for your, like, of course, there was not a single day that you were being frustrated. There wasn't a single day that you were being stressed, right?
Hmm.
Just before the exam, just like suppose 1 month before the exam, you're being stressed. Definitely, we're human, right? We are being
Hmm.
frustrated for reading these things again and again and again and again. But you guys have overcome those things, right? That's
Yeah,
a
we
that's a
have.
beauty of
We
it.
have. Yeah.
Very
Yeah.
nice.
It's a relief.
So
It's a
yeah,
relief.
I think it's a big relief. Like, Mount Everest has, like, gone away over from our chest, right? So it's
Yeah.
a big
Yeah.
relief. I know, I can
We move on to
understand.
the next stage. We
Yeah,
move on to the
yeah.
next, and
So
we hope
I think, like, this will put a huge career impact for your next steps. I'm pretty sure
yeah,
about that. It will
I hope so.
influence your career planning in a different level, and
Yeah.
you will have a lots of benefits out of it. Not only the benefits, you have become a good doctor that I can sense very easily,
Yeah, yeah, I really have. I really have.
right?
I'm a different doctor compared to when I
Yeah,
started,
yeah, yeah,
preparation for these exams.
and
It
yeah.
really
So
makes you, I think it does make you a better doctor than you
yeah.
are.
Yeah,
Because
I know, I can
if I was,
understand that is the reflections that all the candidates will have after they are going to start their like, journey, and once they will pass the exam, right? And
Mhm.
I really delighted to be a simple part of that journey, right? Like, I have tried to make you a good doctor instead of becoming like, a memorizing marked up doctors. So I'm
Yeah, yeah,
delighted to be a
yeah.
little bit of part of that journey as well. Yeah,
Yeah,
that's
yeah.
what I can say.
That's true. That's true.
Yeah,
Your critical care videos, you don't just go
yeah,
giving us answers. You want us to
no,
understand
yeah,
everything
yeah,
before you even give the actual answer. And that's
yeah,
why the videos are long. So people think,
yeah,
oh, the videos are long. I just want to,
yeah,
read the PDF. I'm like,
mm,
no, I wouldn't read just the PDF. I
yeah,
like watching the videos because
yeah.
when you understand,
It's
it
kind of
makes
story,
things so
yeah, right? It's kind of a
easier.
story.
So
You just
easier in fact, yeah.
build block some stories, right? And then you will
Yes,
mention the exact impact points, why I have mentioned those stories. Yeah,
exactly.
it's just
And
like that.
even like ward rounds, when I'm on ward rounds, my consultants now, and then last time they were asking about alcohol and
Mm,
how it impacts the liver. And I was
yeah.
going through the steps, like how it taught us. They were just surprised. They were just looking at me like, wow, wow, that's nice. And it's really, it's really nice,
Yeah,
If I just knew an answer, it wouldn't, but
yeah,
trying to explain everything in
yeah,
that
yeah.
steps. It's not just for the exams, it's for your
Yeah,
whole
it's not
life.
like,
Trust me.
trust me. Yeah, that's what I
Yes.
said. Like, see, this is not for the exam, right? I
It's
have
not just
tried
for
to
the
make
exam.
yourself as a good doctor, not think. In the
Yeah.
very first place, I always mention to all the candidates, come on, this is not for the, like, people who wants to memorize the stuffs, right?
No, no, no,
These are
no.
long classes. You need to put yourself, you need to work hard. This is not like, a very quick and, like, short courses, something like that. It's not like that. It's a
No.
full thing. You need to put a lots of effort into it. I'm giving my own effort as
Hmm.
well. I'm taking the classes, every class is live. Why?
Yeah.
Right? Because almost the same
Yeah.
thing, 90% to 95% are the same things, right? But I'm taking
Hmm.
this live. Why? Just to make sure you guys can participate. You guys can put your all the brains into it, right? So yeah,
Yeah, that's true.
lots of things.
All right.
Okay.
All right.
Yeah, Kelvin, it's been more than an hour. Can you believe that?
Wow. Wow.
Yeah,
Thank you so
yeah,
much, Dr. Tik.
yeah. So
Okay,
it's been
thank
a
you for
very,
this
very good time
opportunity.
that
Yeah.
you have taken. And yeah, Alhamdulillah, you have done it. And once again, big, big, big congratulations, brother. Okay.
All right. Thank you.
I'm
Thank
really,
you. Thank
really,
you.
really, really happy.
Thank you.
Yeah.
Yeah,
All
I'm
right.
also happy. Yeah.
Just
All
always try
right. All
to
right.
help. Okay. Just try to help
Yeah.
all of the candidates, whoever needs any help
Yeah,
in the
yeah, yeah.
future.
I have some candidates who text me and then
Yeah.
we are chatting and we are doing our best what we can
Yeah.
for them,
All
if
right.
only they can understand the process.
Yeah. Yeah.
Yeah.
Okay.
Okay.
All right, Dr.
All right.
Kelvin.
Thank
See
you
you,
so much,
brother.
Dr. T.